We'll get started here. Welcome everyone. It's the 2024 budget hearings, and our first presentation is health access, and take it away.
All right, well, thank you. Good morning. My name is Megan Skaggs. I am Executive Director of the Shawnee County Medical Society Health Access Program. Thank you for having us be here and supporting our cause for as long as you guys have. We started Health Access in 2002, and since then we have improved access to health care for 17,410 unduplicated low-income uninsured residents of Shawnee County. As a refresher, Health Access combines donated physician care, hospital services, dental care, optometry, and medication assistance in a coordinated program led by the Medical Society. We are one of only 4 counties in Kansas that has this model of charity care, along with Shawnee County. Also has this model in place is Sedgwick, Wyandotte, and Johnson counties. So our goals since 2002 have remained the same. We want to improve access to health care. We want to improve health equity and have an efficient coordination of physician volunteers. We are very proud to share that we have over 340 physician volunteers who live and reside in Shawnee County that volunteer and donate services to our health access patients. We focus on preventive care. We work alongside with the safety net arms of the Shawnee County Medical Program. We work really closely with Grace Med, with Vallejo, with Pine Ridge Family Care, with Stormont Vale and KU St. Francis. We have a great collaboration with all of the medical arms, you might say, of Shawnee County. Once we get patients enrolled in Health Access, we get them access to specialty care, dental, optometry, and most importantly, the prescription assistance. To qualify for Health Access, patients must live in Shawnee County. They must be under 150% of the federal poverty guidelines, and then they must have a primary care provider. A lot of patients come to us without a primary care provider, and that is a requirement to be in our program. So we work alongside with them to get them established with primary care. That alongside is that preventative measure of the Health Access Program. We work with about 1,500 patients a month, individual patients. Patients are enrolled for 6 months at a time. They can renew for Health Access as long as they remain qualified, but every 6 months they do need to send in their financial information and complete the renewal application. Most of our patients are under 100% of the federal poverty guideline. We hover around 80% of our patients are under that 100 mark, but all of them are under 150% federal poverty guideline. Nearly 60% of our patients are female, which you might say that many of them are probably single mothers and are having to decide between choosing medical care for themselves or providing for their children. Our most common zip codes for patients enrolled in Health Access are 66605 and 66607. We do survey our patients every 6 months when they renew, and we ask them if they've been to the emergency room in the previous 6 months, and 91% of patients in 2021 reported they had not been to the emergency room in the previous 6 months. So that goes to show that that preventative care really does work. Let's see. One of the programs I want to highlight today that we do with Health Access is our LINK program. LINK stands for listening to your needs, identifying your goals, navigating your community, and keeping you healthy. This program is one that we are most especially proud of at Health Access. It is a collaboration between us, Stormont Vale, Vallejo Behavioral Health, and Harvesters. And this program works as a collaboration to address the social determinants of health for residents living in poverty in Shawnee County. So our work with the LINK program is to go beyond the traditional healthcare safety net system. Our community support navigators are going to residents' homes. Some of our patients come in with living in a tent or being homeless, and our support navigators are out on the streets, boots on the ground, helping them reach their goals, helping them achieve housing, helping them do a number of different things. Almost all of our LINK patients face multiple complex issues. The average amount of issues that our patients enrolled in LINK face is 8. And so these include housing, access to SNAP benefits, vocational rehab services, prescription assistance, food, job searches, and assistance with transportation. Every patient in LINK works towards completing goals with their support navigator, and then upon completing these goals, they will then graduate from LINK. Oftentimes, when they are graduated, they have either obtained Medicare or Medicaid services or achieved gainful employment with health insurance of their own. So the goal of LINK is to have our LINK patients no longer need health access. We're helping them apply for disability, Medicare, Medicaid services, gain access to things that they probably qualify for but don't know that they qualify for or don't know how to navigate that system to achieve eligibility. I do have a couple success stories I want to share. I won't go into all of the details. It is on the back of the handout that I have there for you. One of our LINK patients, we'll call her Chelsea. She was a 32-year-old female who was married and homeless prior to enrollment in Health Access. Once patients are enrolled in Health Access to qualify for LINK, they must reach 2 of 3 parameters. They must be homeless. They must have a rising risk score for readmission to the hospital, or they must, homeless. There's 3. It is a Monday morning, I will tell you that. Homelessness, rising risk score, or food insecurity. That's that third measure right there. So Chelsea, due to her, she had several mental health disorders. She also has COPD, and due to her severe and persistent mental health illness, she was unable to work while waiting for a disability determination. Once she qualified for our LINK program, our support navigator helped her with assistance applying for disability, applying for Medicaid and housing, and also with prescription assistance funding. That really is key to many, many patients who come to our program. They might know that they have a health issue. They might know that they need access to this prescription or that, but they don't have the funds to buy those prescriptions or purchase those. And that's where our prescription side of the Health Access programs come in, as we help purchase those prescriptions for them. So once she was with her LINK Community Support Navigator, she was awarded a housing voucher, and our support navigator then helped her search through. Once you achieve a housing voucher, doesn't mean that you achieve housing. There's a whole nother set of stairs to climb, you might say, when you want to get housing, even though you have a voucher. So shortly after, she was then awarded disability and Medicaid, and during her time with LINK, we had drastically reduced her emergency room visits from multiple times per month to 2 visits or less each quarter. That was a big reduction in emergency room visits. The next patient I want to highlight is probably one of my most favorite LINK stories, my most favorite LINK patients. We'll call this LINK patient Mary. Previous to her enrollment in the Health Access, she had been to the emergency room 9 times in the previous 2 months. Once she was flagged for maybe qualifying for Health Access and then LINK, we got her qualified, we got her enrolled, and referred her over to our LINK Community Support Navigator. Mary was immediately identified as needing an inhaler for COPD, and we were able to help her with paying for that inhaler. She also had other multiple prescriptions that she needed. She enrolled in LINK in fall, and during that time, she was then able to apply for the Advisors Excel season of sharing in that Christmas season. The city of Topeka then approved her for funding for a new wheelchair ramp and porch modification for the home that she was living in, allowing her easier access to get in and out of where she was living. Upon enrolling in Health Access, the first 6 months, she had not visited the emergency room at all. And that, I think, is a drastic improvement. Also, probably my favorite part of the story is once she had faced the second, so enrolled in fall, that next Christmas season was coming up, and she had shared with her support navigator that she felt like decorating for Christmas for the very first time in years. And it just goes to show that you meet the physical health needs for someone, and you help them figure out things in their life, achieve some goals, and their outlook changes so much. She's still enrolled in our LINK program. She's still facing some issues, but she is one of my most dearly loved patients. I do love her quite a bit. This just goes to show these link stories that access to funding for prescriptions is critical to the success of our program. Over the last 20 years, we have had a total cost of our prescriptions of over $3.7 million. The Shawnee County Commission is a big part of that funding, a big part of helping these patients get access to funding. We have a $5 copay for our prescriptions. We only cover generic prescriptions, and we work collectively with pharmacies in town. They reduce their dispensary fees. They work really closely with us through our formulary company prescription network to make sure that we are paying as little as possible for these prescriptions. We also, we also work with patients on giving them education for additional resources to low-cost prescriptions. We give every patient a GoodRx card. We try to educate them that, look, we might have a $5 copay, but with GoodRx, you might have a $4 copay. And that really does mean a lot for patients over time if they're able to save $1 here or $1 there. Also, Grace Med opened up their pharmacy this past year, and that has been a really big boost to our patients. And that is another great funding source for access for prescriptions to our patients. But we still maintain that high need from the Shawnee County Commission. And so we are asking once again the same dollar amount that we have asked for in years past, $110,000. We are very thankful for the past support that we have achieved, and we thank you for all of your support over the years. Collectively, since 2002, we have recorded $250 million in charity care, and that statistic, once again, of 17,410 individuals since our beginning. I'll open it up for any questions that you might have at this time.
Mr. Chairman, can we talk a little bit about the state grant that you received?
Yes, we had last year, we had received a one-time grant from the state of Kansas in the amount of $250,000. That was a response to the cuts that we had received throughout COVID-19. We did ask for that funding to continue, and we did not achieve that funding. That request was declined from the state of Kansas. And so that dollar amount, that $250,000, what that is doing for us now is we have that funding set aside to close the gaps in our yearly budget. Without that funding, we would have a negative yearly budget, and we have that set aside for at the end of every year. We will get with our accountant service and say, this is what our shortfall is going to be this year, and we will then transfer that money from the account we have it set in to essentially reach a balanced budget every year.
So it's going into your reserves, or?
Right, yes, right now it is in our reserves, and then we have that set aside for our budget so that way we can be balanced.
And that was a total of $250,000. And what are the reserves at now?
Reserves that we have, so we this past year, we had transferred 65,000 to, we had a big funding cut from the Kansas Health Association, Kansas Health Foundation of funding, and so we had a larger need for that this year because we had expected that funding to continue, and it didn't. So we had that to transfer a larger amount. We hope that this year we are only having to transfer somewhere around 40,000 to meet our budget cuts to achieve that balanced budget.
Okay. Yep, thank you.
Megan, if I see this correctly, it looks like you're anticipating in '24 about 63,000 that you would need.
Oh, was that what we had on there?
Well, for '23.
For 23, okay.
It's 37,000.
Okay.
For '24, you're proposing.
Yes. Yeah, so for
estimating
23, yeah, we're hoping around 40, and then 24, because some of the, there's so many other funding grants that are unknown. Yeah.
That's on the last page of the information they gave you.
You mentioned earlier that all your clients have to have a primary care physician. How do you have difficulty linking them up with with doctors? Or?
The vast majority of our patients get their primary care from Grace Med or Pine Ridge Family Care. They accept all health access patients without a qualification. So we just make sure that they have their first appointment date and time set before we get them enrolled.
Are they compensated then somehow?
No, they work with patients on a sliding scale fee, so every patient enrolled in Health Access will have a copay over at Grace Med or at Pine Ridge. Now, we do have a large number of primary care doctors who are employed through Stormont Vale or KU St. Francis, and then patients would not have a copay with those primary care physicians. The difference is there is such a high demand for those private physicians that we essentially, a patient will come in and say, oh, I have seen this doctor before and I'd like to continue seeing that doctor. So we then send a request over to that doctor to approve or unapprove, enrolling them in Health Access with them as their primary care. And most commonly, if a patient has been with a primary care provider before, they're going to say yes, they will take them. So the new patients sometimes are hard to find primary care if they don't want Grace Med or Pine Ridge. But I do have to say that Grace Med and Pine Ridge are both really great options, and they work really great with our patients.
Thank you. Any other questions?
No.
Thank you, Megan.
Thank you.
All right, thank you. Have a great rest of your Monday.
All right.
Move along all you can. So, yeah, just ready to go. So, Chairman Rippon, Commissioner, staff, thank you so much for being here. I am Bill Persinger, Chief Executive Officer at Vallejo Behavioral Health Care. We're here along with people just came to support Megan Skaggs, so we're done. Thank you. It's unsolicited. I guess she left the room. She won't hear me. You saw me nod my head back there. This is a great partnership. We go to the meetings, we make our own contributions, and we know how important your funding is to those folks as well. One of the many partnerships, in fact, mentioned in our presentation here. I might start with introductions, and I think I'll defer first to my governing board since they sign my paycheck. So let's see. I want to just start over here with V. Just stand up and introduce yourself real quickly.
Yeah, my name is V. Highland. Nice to meet you all. Is that this on here?
And you have an independent business here in
I
Topeka?
do. I'm with
see you again. I represent consumers who experience mental illness.
Frank?
Good morning, Commissioners. Good to see you all again. Frank Henderson, past chair.
Go back to Linda.
Good morning, Linda.
You know.
You all moved up in the world. This is very nice. Good to see you again.
Hey, no introduction needed back there, but
I'm
anyway.
Brian. I am honored to have been a former employee of the Shawnee County, so thank you for having us.
Next, I want to introduce our good partners. Kathy Mosier, you'll hear from Kathy and Brian here in a minute.
With Family Service and Guidance Center.
And Sarah.
I am Sarah Miriam. I'm Kathy's assistant. I just started on June 26th. I'm happy to be here with you all.
Just in time, Tyler. Go ahead.
Forgive me for having up.
We all wandered through the construction together.
Tyler Levere, Chair of the Board of Directors for Vallejo. Good morning.
Brian.
Hi, I'm Brian Blevins. I'm the Chief Executive Officer for Breakthrough House here. We're glad to be here.
And I know you'll hear from Kathy and Brian here in short order. In fact, I'm going to be quick about it to cede some of my time to them or to reserve time for questions and answers. I want to start off by saying thank you. We would not be your community mental health centers without your support now, at least in Vallejo's case, since 1967. I know Family Service and Guidance Center have been around, that amount of time and then some. We just simply would not be here without your support. And it's, the dollars are important, and we are asking for a small to moderate increase. What's most important is the accountability, that you know who we are, you see our faces, we're right down the street, you have our phone numbers. If there are questions or concerns or ideas, and all of you have passed ideas to us that we've used and or are following up on, but we want you to know that your community mental health centers and its partners are accountable to you and to the people, and those tax dollars we get are so precious. Might just refer you to the cover letter. It's there to say thank you, and to also a marker for the records. There's then an overview of each of the organizations, and what we reported are the individuals who are admitted for treatment and services. What's not reported often enough are the thousands and thousands. I know at least in Family Service and Guidance Center's case, 10,000 contacts in the community last year, and we all just have so many contacts out there we wanted you to be aware of. We talk about the number of persons that are employed. You can see that there. Might just continue to run you through the presentation document right up to the end. There's a look forward there on page 3, kind of where each of the organizations plans to go, and then a chart showing the history of your generous giving and an ask for calendar 2024. Might point out that both Vallejo and Family Service and Guidance Center, as of 12:01 a.m. on July 1st, became CCBHCs, certified community behavioral health clinics. That's a very big deal. It's a transformation of community mental health and addictions treatment happening all over the country. It's come to Shawnee County, and going forward month by month, you'll see improvements in access, quality of care, follow-up, data. Medicaid funding should increase pretty dramatically. So we're just out there talking to our grant sources and contract sources like the county, the state, the city, the federal government, staying in there with us as we continue to grow and get better and look forward to the future. I will tell you, and I think I've mentioned it before, for the first time in my long career, city, county, state, federal government all stepped up in the last 3 years to help out with public behavioral health care around lots of issues. Homelessness and crisis care and services for kids and suicide rate, fentanyl and methamphetamine problem. It is so heartwarming and warm and encouraging to have our work validated in that way. And our other message is, none of us are in this alone. You all as overseers and the accountable base organization, as far as I'm concerned, the base level of government to which we're accountable for as our part of our funding set up. None of us are in this alone. Everybody's putting in, and we're just trying to be good stewards of those dollars and put them to work where they need to be. I can stand for questions if you have any, or I can turn it over to Kathy, and she can brief you on where they're at, and she can take questions in and turn it over to Brian, or we can just take questions as we go. We're pretty flexible and want to stay within our allotted time. Just turn it over to Kathy.
Yep.
Let me reintroduce Kathy Moser, Chief Executive of Family Service and Guidance.
Well, in addition to Bill's fabulous reporting that he does on behalf of all three of us each year that we're thankful for, I'll give you a few little comments about family service and guidance. You already received our annual report several weeks ago and know that we had a deficit year because expenses were rising and funding was not rising as fast as the expenses. So in addition to the widest array and diverse services that we have for outpatient between Vallejo and Family Service and Guidance to cover the lifespan of our community's needs, we also at Family Service and Guidance have youth crisis beds, much like Vallejo has the ones for adults, we have the youth. So with that preempting the fact that in November, we will be opening the first recovery beds for youth for addiction and recovery, alcohol, drug use. So that is a need that came up time and time again in our community needs assessment. And that building is going up so that we can add that service to the regime. In the meantime, last year we added alcohol drug licensing, and so we now are able to provide that best practice of simultaneously treating alcohol, drug, and mental health at the same time. It used to be that you do one and then the other, and now we know with evidence-based practices and a lot of new research in mental health that our best practices are really evolving fast now, and we have to stay current on those. So we expect that with these beds, these will be the first ones in our whole region to have these youth, and there's only one other major one in the state, which is in Olathe. And we expect that this access will result in great savings for the county and many other budget areas. Now let's talk uncompensated care. So FSGC provided uncompensated care of $2.8 million last year. That's a number that we expect to grow this year significantly because people are not required to renew their marketplace health insurance and health care. And for children, the federal rollback for Medicaid, the COVID rollback, is causing a high number of children to lose their Medicaid status. And KDHE has confirmed this. So the additional funding that we're asking for this year is to recruit and retain the staff needed to be able to open our addiction youth unit and ramp that up. I have heard conversation about, when it comes to alcohol and drug treatment, about relapse and kind of questioning whether treatment really works. And that's understandable because it used to be. Mental health is in its infancy compared to the medical field, hasn't been around as long, so it's evolving very quickly now, especially with COVID. There's a lot more research that's been attributed to mental health, which is helping us get better. But based on those conversations and questioning whether it works, what you may not know is how the evidence-based practice of alcohol drug has evolved over time. And now we know, and we do not count relapse. It used to be measured on a failure of treatment, and now we know that's not the case. Sometimes it takes 3 or 4 tries before you get all the way to that recovery state that you can maintain. And so now that's part of the recovery process. And they've even changed the definitions to there's a full-blown relapse, but there's also what we call slips. And those slips are going to happen, but they get right back on the horse and they don't lose all the ground that they lost before. And now we know that, so it's not like starting over. That is something that I think is kind of a myth out in the community or old information that we're trying to get education out there. We do know that treatment works and it gives a great return on your investment. For instance, one of the things we're trying to do is to reach outside our 4 walls to catch the kids and youth in our community who have been falling through the cracks. So we've been focusing on putting our services and our staff in schools And the 501 school district just got their results for last school year. And they measure these and tell us how we're doing in our programs. So for the kids that we reached that were in our programs in the schools, their attendance at school increased by 69%, their grades increased by 72%, and decreased what they call behavioral write-ups in the school, decreased by 74%. Now that's going to have a huge impact on county budgets in other areas as well. So we're really proud of that partnership with the schools, and we're really proud of how well that's working. We also were able to expand that this last year. So we went from, we served 428 students that were not making it through our doors otherwise, and that increase was 129 students this year. But there's more work to be done. It's imperative that we have your support to grow with the growth that we're seeing. Otherwise, we're going to be having to turn people away, or they're going to have to wait so long that they're not, then we know that it's more costly and it takes longer because they become more severe in the meantime. CCBHC helps cover our costs better than it did before, but the funding's been so inadequate, it doesn't pay for all of it. People need to access behavioral health and primary health. Stigma's declining. As you've seen in our Olympic athletes, you've seen it in our musicians, you've seen it in our actors, our famous actors. They've come forward with their mental health challenges and recovery. What they're trying to say and what we're trying to say is we know that there is hope and that recovery works and that treatment works. So take that first step to get that extra help. And now's the time that people, because of all of this and this attention to it, that people are coming forward more than they were before. So it's really important that as people are starting to choose and say, hey, I need help, that we are there and can help give that help so they don't walk away unserved and give up. So it's really important that we grow with that need. When we're equipped with evidence-based treatment and supports, which our CCBHC is allowing us to do more of and get even more progressive and bring in more best practices, youth and adults can regain their lives and can contribute to family and community and our society. And one last little quick plug I will throw out there is that our fundraiser is coming up. The Works of Heart is going to be on August 5th this year, and we would love you all to attend, and I have some invitations for you. And with that, I will either take questions or I will turn it over to Mr. Brian Blevins with Breakthrough.
Questions?
Oh, thank you.
Thanks, Kathy, and thanks, Commissioner. I really appreciate the opportunity to be here and visit with you this morning. Next time I want to go first. You guys covered so much good ground. I don't know what, but I hear you. So, I think one of the things that I've only been with the Breakthrough House now for about 7-8 months. What I bring is a little bit more of a clinical background to the organization. And one of the first things that I noticed when I got here was that, again, the climate right now is extremely powerful and exciting. There's a lot of different agencies that are supporting this push towards solving some of these problems that we have that are massive. And so it's not, the county, the state, the city, everybody's kind of getting together as well as the other organizations to collaborate and work on this. One of the first things I was introduced to when I got here was that Mr. Persinger had invited me to a collaborative group to introduce me to all the other agencies in the city so we could get to know each other and know how to use those agencies more effectively. What the Breakthrough House does, the part that we're looking at or want to talk about a little bit this morning is our clubhouse. It's an international model, and what we do is when when these two other agencies get people stabilized, we want them to come into our clubhouse and move along that continuum of care towards a more independent life and prevent them. We want to reduce the number of times that they go back into crisis. Now, just to briefly give you a little bit of the science behind this, my background's in the neuroscience of addiction, actually is where I started. My mental health background is, well, I married a therapist, so, which has the added benefit of saving me a lot of money. So, but she also, she gives me a pretty good education. This is a kind of a study in what they call interpersonal neurobiology, and you see the outcomes of it. As scientists, we look at outcomes. We're not really so much interested in theories. If you look at the recovery process, as Kathy was saying, we have 23.5 million people in long-term recovery as a result of these supportive environments that we put people in. Harvard did a study that proved that people who engage in social supports in times of stress have better health outcomes than people who have no stress at all. It's an amazing thing, and we can get into a lot of what happens when you get influxes of oxytocin and things like that, which happens when you're in these supportive environments. But the truth is, we see it in the outcomes. It works. And so we have a clubhouse, an international model, that is designed to bring people in that have similar conditions, mental health conditions, and through the fellowshipping of each other, they get to see the success of each other, and they get to support the success of each other. We engage them in work programs, and we have some amazing partners in those work programs here in this community that welcome the opportunity to take people in that are challenged and help them get better, and they show a great deal of patience. So what I've done and what we have changed to is, again, a little bit more of a clinical model, which means we've hired an LMSW to run our clubhouse. I purposely hired a couple of case managers that are familiar with Vallejo and know how to interact well with Vallejo, know how to collaborate more effectively, so that we can see the outcomes that we're getting effectively work. When people do enter into a little bit more of a crisis, and they, as Kathy again was saying, when they slide and back and forth into this continuum of care, they don't always, it's not a linear line, so we can access them, those services back with Bill and then bring them back into the clubhouse, and they move along that continuum faster and better, and we capture those crises and move on them a little faster with a group of people that understand how to do that have a clinical way of thinking and know how to help people. So unfortunately, it costs a lot of money. So I think every organization now is challenged by the fact that there's not enough professionals, and so in this industry, so we have to really aggressively go after them, and that's one of our bigger challenges right now. But we're really grateful again for the help we're getting from everybody to see this happen. Even KDADS is changing some of the rules so that we can get some of these problems solved. So anyway, that's kind of a brief summary of what we do and what our mission is. Our mission is to move people with mental health issues into independence and keep moving them independence through housing and work programs and education, teaching them how to live again. Once they stabilize emotionally, they can learn how to live again. It's kind of hard to do that when you're in an emotional crisis, but once they stabilize, then they're educational, and it helps, it works. So I'm open also for any questions if you have. If not, I'm gonna turn it back over to Bill. And
I noticed in the little blurb in here, it said you wanted to increase educational material. What does that look like? Is it?
Well, one of the things, we have a library, but I have determined that since nobody goes in there and reads, it's going to be a lot more beneficial if we get some audiobooks. And so we're going to move to an audiobook type setting. And one of the educational things that we want to teach people how to do is finances. You know, we love to see people move out of our payee program and into independence. We graduated 2 people in the last 3 months, you know, from our payee program. And that's a success to us. You know, we tried to work ourselves out of a job. Teaching them how to build resumes and stuff like that. They can listen and learn, and just expanding the different ways that they become teachable, not just visually, not just reading, but also audio. It really helps if you broaden that teaching environment.
All right, well, thank you.
Bill?
I'll just, I can kind of moderate the discussion from the podium, or we can just.
Well, you have to come to the podium for this recording.
Or- We want you on TV here.
Yeah, there you go. I'll just stand here, and if it's to me, great. If not, I'll just field the questions out, or just whatever you need to be. So we're at your disposal. We can, whatever time you folks have, if we can keep you ahead of schedule, that's great. But our time is yours. So, and we're just proud to get so many people in the room who believe in what we're doing and are accountable to you folks.
Bill, I was just wondering about fentanyl. Are you seeing a big uptick there in use of fentanyl? And
We are. Incidents are out there happening. It's catching up kind of to the methamphetamine crisis that we have. I don't know that it'll be the same scale and scope, since, the methamphetamine is so easy to manufacture, use, and, unfortunately distribute. But we are seeing an increase. In fact, we formed a partnership with Vallejo Family Service and PARS Topeka to begin to learn more about the fentanyl crisis. PARS has led community discussions with data from the KBI and others that we've been able to look at. They're helping set social policy, and our aim going forward is to be able to strengthen the substance abuse system that we have, not only for adults, but with kids and their families through that partnership with PARS Topeka. But yeah, Bill, the quick answer is an increase. Our number one problem, though, for adults is, remains alcohol, methamphetamine, pretty much in that order, and the fentanyl is kind of coming up next, but an increase. Yes, sir.
Bill, you might talk a little bit about your relationship with the jail and how you guys work with our corrections.
Yeah, I'll tell you what, it's one of our primary partnerships, other than Rescue Mission, our TPD, the Sheriff's Department, the Vallejo, or, Family Service and Breakthrough House here in the room. So we have a number of things going on with the jail, and thanks to you folks, with some specialized funding, we have a full-time addictions counselor in the jail through some money that Vallejo matches out of its own coffers, a grant from Rotary International, and I'm going to misspeak as soon as I say it's the Women's Fund, but a local charity. We fund a full-time case manager at the jail. It's called the Intersection to Care program. It works with women who have been trafficked out in the community prior to being in jail, or women that we think are, maybe at risk. And so we try to get in there, make a connection with them on a daily basis, and, try to get some aftercare set up so that when they leave the jail, whether it's tomorrow or in a year, they're entering a more supportive wraparound environment. And then we've got, we can follow up with people's medication. Sometimes people leave the jail, come into our 24/7 crisis program, just a number of interactions with the jail, working on competency stand trial, a number of other things. So a lot of initiatives going on with Director Cole and his team. And if we don't, Dick will get after me. So that's our motivation. So no, we had to tell you, it's one of our primary partnerships. We are looking forward someday to a mental health unit that Director Cole can operate. One of the exciting things I think going forward, just in terms of planning, is maybe like a reentry program as you leave the jail. Can we put you through a gauntlet of opportunities right there on site or in some nearby facility that will wrap supports around the individual as they leave the jail? Sometimes director gets an hour's notice somebody's leaving. Sometimes they know in a few weeks or a few days, but we'd like to be a part of that team going forward as well. We've hosted other counties to come in and learn what we're doing. The director's taken a leadership role there and is to be applauded for that.
And you do some of the evaluations for people for competency for standing trial for trials, and I suppose that takes a lot of pressure off Larnard, I suppose, in some fashion.
Yeah, Vallejo itself, our staff are trained. We haven't employed them yet. KDADS through Larnard State Hospital sent the director of the program, Dr. Barnum, to the jail. We did a pilot project. Our role at Vallejo has been to facilitate the meetings, kind of keep some of the details going forward, and then of course, Major Phelps and Director Cole have carried a lot of water on in terms of getting the program instituted. But yeah, we have And then there's a psychiatrist been, doing that work for many, many years successfully. He's doing the evaluation piece. What we figured out through a change in the law that we helped with, and our intersection coalition, which has broad involvement from a lot of different individuals and agencies, have figured out that we can do some of the restorations to competency here in a jail. And so we've done some seminal work in a pilot to demonstrate that we can save trips back and forth to Larned, we can save time, dignity, expense, and it's not happening on a wide scale yet because we're all still gearing up, but the court now has actual documents for prototype court orders that they can use. I know Judge Wright has been particularly involved with all of that, and prior to her, Judge Parrish. Just making sure that we have everything in place. If an individual can be restored to competency at the jail in an hour or 10 hours or 10 weeks, can we do that locally versus going to Larned? We hope someday that the standard of practice is that most are done here. The individuals who have maybe challenges beyond what the jail can respond to would go to Larned. So great progress there, Commissioner. Thank you for asking.
Any other questions?
Thank you so much.
Thank you, Bill.
I'll just kind of stand here and just kind of be a figurehead for other questions of these folks.
No, I think we're good. Thank you.
All right, well, I know on behalf of everybody, we appreciate your time. Have I left anything out, crowd? Am I okay? Well, we appreciate you folks so much. We wish you a good and speedy process here. Thank you so much.
Thank you, Bill.
Thank you.
Take the whole hour, though. Don't take the whole hour.
Well, we can try. Awesome, thank you.
Okay, our budget session's back in session now, and our next presentation will be Conservation District. Get the right page up here. Thank you.
Well, I'll see if I can regroup quick enough. Well, good morning. I'm R.J. Dake, and I am chairman of the Shawnee County Conservation District Board. And we have Francis Kelsey, who is our treasurer right here. And we have Wayne Lukert, another board member, and Megan Dix, who is our, officially our, yeah, I always get the titles a little bit confused, but she's in charge. How's that? She's our district manager. So in front of you, you see a little bit about some of the things that we do, and you also see our previous budgets and our proposed budgets for what we would like to see happen. You'll note, and I would be a little bit proud of the fact that we're pretty conservative in our ask, and we tend to be that way on a regular basis, but the challenges that you guys have faced are the ones that we've faced too, and those are changing budgets for personnel and associated costs, those kinds of things. So when we look to increase our budget, those are things that are impacted. We are at the moment without a technician, and that has been a little bit of a savings, but it has also been a little bit of a diminishment of our capacity for things that we do and would like to get done. So with that in mind, I would open it up for questions from you and any comments that my colleagues here may want to provide in terms of information about the work that we're doing or the request for the budget. We are very appreciative of the support that we received from you in the past, and very appreciative of the work that you do.
I'll kick it off, RJ. The state grant, you were still not funded to the full capacity of the state legislature. It's just a portion, is that right? Because it's supposed to be a match, and
It's supposed to be a match, and that's always been a challenge. Francis, do you want to speak further to that?
Legislature's authorized up to $25,000, and this last 2 years, we've got $24,706. So they're getting there, but not quite.
All right.
Hopefully this year it will.
And that's a very much appreciated question, because that is one of the challenges of trying to make sure that we do as much as we can with the budgets that we have.
This technician that you have vacant right now, what's their role? What do
They do quite a few things, but most of their activities are associated with field work and support for field work. So for instance, the drill that we provide, getting out there and helping farmers adjust it, or getting it to the farmer or from the farmer and making sure it's in working order, those kinds of things. Wayne has some comments here to add to that.
Yeah, Wayne Lukert. One of the things technician would do is also lay out and do design of conservation practices, terraces, waterways, do plat reviews for us because we are in the loop for doing plat reviews for the county. And it would also help contribute to our share of, we have provide so much service to the Natural Resource Conservation Services, who we share office space with. In fact, they provide office space for us, so we don't have to rent that. But they also expect in return some reciprocal services from them. And we would like to be able to do more than just have a receptionist answer the damn phone. And because there's things that we need to do that helps keep our county in compliance for other things with the Clean Water Act. Because everything the Conservation District does keeps the county in compliance with the Clean Water Act. Somebody from EPA told me this, so that's what kind of surprised me, you know. But anyway, whereas the Natural Resource Conservation Service, NRCS, they tend to focus more on agriculture, some non-ag, but not much, mostly agricultural stuff. But we can help support other natural resource conservation needs that the county may have that are non-urban. We could also work with developers, contractors, builders and stuff like that to help keep them in compliance. So we're not there to provide things for them specifically that a private contractor could do, but we're somebody they could come to and talk to so that they would know what they need to get done. You know, well, we need to be worried about stormwater runoff, we need to be doing this, so that they know they're getting those services from a private contractor or consultant. And that's just kind of a cliff note.
Great, thank you. Any other?
I don't see any.
We're good? No.
Thank you.
Well, we certainly appreciate the expediting of the day, and thank you very much for your consideration.
Saved you an hour.
There you go.
Our next presentation will be with TARC, so if you're ready.
Well, we're ready if we made it.
Okay. You're on.
You weren't aware of the move.
You were at the courthouse.
We were at the courthouse, then they said across the street, which I thought meant the city building. We've covered a little territory this morning, getting our
Welcome.
steps in. Welcome.
You passed the
Thank
first
you.
test. You made it here.
Yes, so I am here along with our finance director, Laura Marple, who is the person who actually prepares all this work that you've had to review. But we are here to present the submission on behalf of TARC, Sheltered Living, which is now SLI, and Cappers Foundation. And you can see that we have requested an overall across-the-board increase of 3%. We have not been requesting increases in the past few years, but we believe that both SLI and Cappers are seeking to do some additional, provide some different types of services. Expanding employment services is one of the things that Cappers proposing to do, in addition to all of the work and supports that they're already providing. SLI is really seeking to cover some of the costs, as you know, probably better than anyone, the costs for maintenance and building have increased dramatically over the last several years, and as housing is what both Cappers and SLI primarily do. They will be utilizing some of those additional dollars for maintenance of the group homes that they maintain, as well as transportation for persons supported. The cost of transportation, gas, continues to be a burden for all of the persons that we support, as the dollars that they receive from, Social Security and SSI certainly don't cover all of their needs currently. And at TARC, we're proposing to also add some funding for our feeding clinic. Now, the feeding clinic had functioned under our Children's Services program. But I think maybe one of you was in attendance when we did the dedication for our feeding and audiology clinic last August. But we have enhanced the services that we can provide to children after they reach the age of 3. So primarily the children that we are serving in Shawnee County are the birth to 3 population. We are the sole provider of Tiny K services for that population in Shawnee County. But we are continuing to serve children post the age of 3 in our feeding clinic. As many of you may have seen when we've done some public service spots in the news, the needs for many of our children don't end with 3 when they turn 3, miraculously. We've had children who remain on feeding tubes, et cetera, and our work with them in the feeding clinic is to assist them in overcoming those feeding challenges that they have. And so we have been able to bill some private insurance unsuccessfully more times than not, but we believe that these services are critical to the well-being and long-term health and development of the child. And so we are seeking assistance from the county also to support the feeding clinic. We are making great strides in our assistive technology, both for the children who are being served in the county as well as adults that are served in our programs. Our assistive technology has also really enhanced what they are capable of doing this past year with I think it's called a DNC router. And so we are now able to create the specialized equipment for the children and in some cases for adults in our very own workspace. And so we have saved families literally thousands of dollars by being able to create that specialized equipment for them. So the chairs, modifications for trays, and not only is it a cost savings because we don't charge the families anything, but they are primarily not the types of durable medical equipment that are covered by Medicaid or private insurance. And so, and families, even if they do have coverage for those items, have to wait 6 to 12 months. So for a child, waiting 6 to 12 months for that adaptive equipment is really lost time. So I wish if I had come straight from the office, I might have brought a little show and tell for you, because it really is amazing to see what our assistive technology department is creating in-house. When we take people on tours and show them, they just are overwhelmed really at what we're capable of doing. Any questions for me today? I came all the way back from Montana yesterday just for this meeting, so I hope somebody has a question. It was a quick trip for a wedding weekend, so.
I feel guilty.
Anything that?
You're asking for a modest increase of 3%.
Yes.
And it's outlined within the budget where that's coming from, so.
Thank you also for your support with our golf tournament and, of course, our partnership with Winter Wonderland. We had a great year last year with Winter Wonderland. Our sponsorships are already up some for this point in time over last year, so we're looking forward to another great year. And the golf tournament made the most money it's ever made, so, even with the rain.
Well, thank you very much for all you do. I think it's a very important service for this community
And again,
well
if
worth
you
the
ever
money.
are interested in coming by to see our feeding clinic, our audiology clinic, some of the work that we're doing in assistive technology, or a tour of our TARC Industries, our folks are working in many different capacities, including document destruction and in our production floor where they're doing packaging, et cetera. It's quite an operation. So, thank you.
Thank you very much.
I'm curious, how close are you parked?
That's the Health Department, so Teresa, it's all yours.
Okay, good morning, Commissioners. All right. Okay, well, once again, good morning, Commissioners. Teresa Fisher, Director of the Health Department. So thank you for the opportunity to present our budget, and looks like you guys are well ahead of schedule today. So just a couple of acknowledgments first. My leadership team and our accountant are with me today, and so along with them and myself, we are the ones who put together today's budget. Want to say thank you to Audit Finance. There was a multitude of questions as we worked through the budget this year, and so thanks for answering those. Just as a couple of notes, the budget, as you're going to hear it today, to my knowledge, has really never been reviewed to this extent. I've been in a supervisor or leadership role for many years, and the time that we took going through each line item, looking at what the line item was, the cost, what we had previously spent or used, what some of the items even were. So this is a very accurate budget for the health department, and one that I feel really had not been done in my time here. The other item I want to note is that we have no capital improvement project requests, so today's presentation is our budget only. So briefly, I just put this slide in. I know it's a little hard to see, and we're a little bit darker in there. We've got our health department jackets, but this is the team, plus or minus a few from that day that I am privileged to be a part of and have the honor of working with. This is the group that does our programming, is out in our community, and is working to make our community a better place. I'm going to go briefly through the divisions. You will see the jobs that each of them do, but what I'm really going to focus on is the FTEs and the vacancies in each of these, and draw your attention to that. We'll talk about that in a few more slides. But to start with the Financial Administrative Division, which is where myself and Mandy reside, we have a total of 12 FTEs. We do have, at the time when we prepared our budget, we had 2 vacancies, one being the division manager of that area that we've been searching for a while now, and an accountant 1. That position is not currently advertised and hasn't been filled since the last person that held that left. Since we wrote our budget, we have an additional position, an office assistant 2, that just retired about a week ago. The Family Health Division, this is Missy's division. This is by far our largest division in terms of FTEs. She has 29 FTEs. There are 4 vacant positions in that. There is an office assistant 2 that is not currently advertised. There is a maternal child health RN. There is a nurse family partnership RN, and there is a dietitian in the WIC program. Our Clinical Services Division, this is Carrie's division, our next largest. There's 18 FTEs in this division. We have 5 vacancies here. We have 1 epidemiologist that's currently not advertised, 1 certified medical assistant that's also not currently advertised. These 2 positions had previously been filled. We honestly had not had a lot of applicants for them, if any, and so when the last position or staff that held them left, we opted to not fill them at that time. We do have 3 registered nurses in the Clinical Services Division that are very much needed. Carrie's working at half capacity right now with 3 of the 6 nurse positions being vacant. And we have been in contact with the State Health Department to see what opportunities might exist to fill those, or at least ways help to make sure we're meeting program requirements. And then last but certainly not least is our Community Health Outreach and Planning Division. This is Craig's division. Craig has 15 FTEs. 2 of those are currently vacant, 1 being the Community Health Planner and 1 being a Child Care Licensing Surveyor. The surveyor is currently open. The Community Health Planner has been open and paused a variety of times. The last time it was open, we just had not landed on the right person to fill that position. All right, I just wanted to highlight a couple of accomplishments and challenges for the health department. So in 2022, two of our biggest accomplishments that we consider are, one, our family planning clinic opening. I chose the ribbon cutting, as which all three of you were able to be a part of. And just recently, you got to hear about our first year in review for this program. So again, excited to have it and being able to meet the needs of our community. The other one being our accreditation status, in which we were accredited last August through the Public Health Accreditation Board. And we're working on our annual report for that. And then shortly, we'll be turning our actions to figuring out what all reaccreditation consists of. Challenges for us are staffing. You now have heard me mention staffing. Again, at the time we wrote the budget, we had 13 FTEs that were vacant, some of which have been vacant for quite some time, some of which are not advertised, but some that definitely have been advertised for quite some time, and a really an ongoing challenge to fill some of these positions. Some of it, I think, is just the position itself. Some of it is just the competitiveness of the division or of the position. So that remains an ongoing need for both myself and my staff. And then I listed grant opportunities. Grant opportunities I view as a challenge just because you heard a larger presentation this year about our aid to local slides, and we'll touch just briefly on grants at the end of the presentation, but many are formula driven, not keeping pace with our salaries, which makes it an ongoing problem. And really keeping track of what grants open, it's hard to do. The individuals in this room and myself are the ones who monitor for grants being available and then write for the grants. And so there's no dedicated staff member, but trying to instead carve out time in everyone's schedules to monitor for grants and making sure that we can put together a quality application is a challenge. It's one we rise to pretty well, though. We recently applied for a federal grant and then a state grant also that we're proud of those new grants that we're going after. So getting into the budget piece here, our total request this year is $3,564,435. This is just a simple breakdown of what that consists of. I would guess that our department is not unlike most departments in that we spend the majority of our request on our staff, on salaries, wages, and benefits. And so that breaks down to approximately 83% of our operating budget, and then 17% is operating expenses. I do know that this is a large, sizable, whatever adjective you want to use, request from last year, but we'll spend some time over the next few slides going down and breaking it down and what makes up that large increase. This slide right here deals with our salaries and our benefits comparison. So we looked at those positions that are currently staffed and what the salaries and benefits would be for them, which is just over $2,040,626. And at the time, again, we had 13 FTEs when we put together our budget, and those comprised $926,647. I think it's worthy to note we are not asking for any new positions for next year. It's critical that we fill some of these positions that remain open and figure out a way to get some staff members into our department. Of the vacant staff positions, we do have that breakdown there, that $926,647. I want to note that $430,233 of that are grant funds. So of the positions that we've listed, some are entirely covered by grant funding. That leaves $496,414 that is funded by the operating fund. We do have, to break that down a little bit further, we've got 4 FTEs that are completely non-grant funded. Those are right around $275,000. Of those other dollars that I spoke of, really those are a mix of positions. So a good example is our maternal child health registered nurse. That is a position that is 60% grant funded, the 40% match is required, and those have to be from outside dollars, and so we use our general fund dollars to match those dollars. So we've got a variety of those positions that are in that, where we have some grant dollars to fund the position, but not enough grant dollars to be able to spread to cover all those positions. So when we looked at these positions, all of us have really had the conversation of what are positions that we need versus what are positions that we want. And there's some easier positions for us to not fill. Obviously, if they're not currently filled right now, we're not being advertised. Some of that is looking ahead and being able to know that we likely would not be able to carry those positions forward. However, some of these positions, again, at the time, the 13, 5 of those are registered nurses, and 3, again, being in clinical services. So those positions are really a focus of more need versus want for us to be able to carry out our programs. A couple more slides here on the salary and benefits. So this just looks at what our actuals were in 2022. You'll see a sizable decrease for this year, and I'll talk about why here on the next slide. And then our 2024 request is actually not a significant amount over what we actually spent in 2022. This slide breaks down between the unclassified, the union, the classified, and the intermittent, and what our current request was for 2023, and then what the request is for 2024. You'll notice in union and classified, that's where you'll see the largest increase. And this is really, this is largely the difference in our request in our budget this year is our staff. I would be remiss without talking about positions that we've added during COVID, and so we've really looked at those a lot. At the time we began COVID, we had a whole division. It was our infectious disease division. Carrie was here and presented, I think a month or so ago, about her reorganization at 10th Street, and really taking that division and making it into a program that existed under clinical services. At the time, we hired 9 full-time positions in that COVID division, or infectious disease. Of those 9, 5 full-time still exist. However, only 2 of them are filled at this time. Those 2 positions are, one, a team leader, and that team leader was really reorganized and restructured by Carrie and past team leaders sitting and looking at the workload that was being asked of a team leader to do at 10th Street, and just the multitude of programs that they were being asked to oversee, the grants, the program requirements, the staffing, and adding on family planning last year. And so Carrie made the request to reorganize that so that one infectious disease team leader also took on all the rest of the reportable diseases, and including tuberculosis, so that work was spread a little more equally among those team leaders. The other position that we have kept and is filled is an administrative assistant. And this staff member, I would say, is a jack of all trades. This is Carrie's kind of right-hand person that she can call upon. This is an individual that can help with EMR questions, has helped with COVID testing, does meeting minutes to see here for our Board of Health meetings. And so really just an all-around person that helps and assists in her division. I think the biggest item to note in the changes of why we're seeing so much is because we will be rolling off all of our COVID grants that we have had. So we started receiving COVID grants and funding in 2020, and we received those last grants through last year. And so really the majority of all of those grants will be spent by the end of this year. You heard earlier in a financial presentation by Betty Greiner that we were under budget, and this is largely why we have been shifting staff members to use those grant dollars in a way that we thought was the best use of those grant dollars. But the majority will be spent by the end of this year. The ones that will carry over for next year are pretty specific, meaning that only certain staff members would be able to be on them, certain activities covered. It really depends on what the grant allowable is, and those dollar amounts will not be large at all. The next area of the budget presentation is on contractual and professional services. Again, you'll see what our actual was in 2022. Versus our request for this year and then our request for next year. And again, it's just a little under 70,000 is the request for this year. And again, we'll break those down a little bit more. The largest increase you'll see is under our administration, and there's several reasons for that. One, not large increase, but small increase is that the union contract is doing license reimbursements for all of our staff that carry licenses. That is not an allowable by several of the grants that we found out from our funders, so those reimbursement costs had to be added in to be covered. We also have Dr. Erin Locke, who's our health officer. Her fees, she has a monthly fee in addition to other reimbursements, including her medical license and a membership for a professional society. We have been able to code largely and fund most of her items under grants over the last 2 years. And so, again, those costs have to be covered under here. A couple other items that were larger increases were our gas, meaning to heat our buildings, and our electricity. When we reviewed what the actuals were for 2022, we were actually under budget this year. And so we looked at what our actuals had been in 22 and what they've been so far this year, knowing there's also been some rate increases, and so those also increased. Don't know, want to look and make sure, okay. So I have a slide about the insurance premiums that we'll talk about next. And then our clinical services also has some contractual items, including our pharmacists that we're required to keep on contract for program requirements, and a laboratory director. And so both of those obviously come with fees per month. And again, in 22 and 23, we were largely able to fund those under our COVID grants and a variety of other grants that would allow for those. But there will be a larger increase in clinical services next year due to that. So this slide's specific to insurances. I know you've heard from other departments increasing the property and motor vehicles. So per audit finance, we increased both of those at 20%. This year, the increases were a lot more, and I know that no one has the magic ball to know, or the crystal ball to know what those will be, but we increased it at that point, where we were able to cover those increases this year. The other item that we carry is our professional liability insurance that we're required to cover, or to carry, and to cover our staff. So in discussions with the county clerk, we are at the lowest level, if you will, like we're at the minimum level for professional liability. It can't go any lower. And so those costs are then spread out among each FTE that we have in our department. We also carry a small additional professional liability with our provider for our family planning clinic. And then Dr. Locke, her medical malpractice insurance, that is negotiated through a contract, and we feel comfortable that those costs will stay the same. I would note we did increase our professional liability insurance by 10%. Looking over the past 5 years, we felt comfortable that a 10% increase would cover what we have seen as increases for those. Okay, the next section is our office supplies, program supplies, and materials. I'm happy to report that this request did go down by just over 7,400. 2022, we obviously had a lot. Looked like a different year on a multitude of levels. That was cut a lot for this current year, and even more so for next year. And I think that's just a testament to these individuals in the room looking at what they were actually spending money on. This, over the past several months, I can't remember for sure when we got everybody in, but these individuals are actually approving PRs in finance enterprise. So fully seeing what costs are hitting grants, what costs are hitting their general fund codes, and learning really about different costs that some of us didn't even know existed at the health department. And so doing a really thorough review of that. So again, these costs did go down. Then we have revenues. So for 2022, we brought in just over $450,000 of revenues in these various areas. These areas that are listed here are the ones that actually have a fee for service. This year, we forecasted $363,075. I'm happy to report that when we looked at our revenues for year-to-date, they were January through about June 20th. For an example, immunizations there was forecast to bring in $152,000 this year. At that point, we'd already brought in over $210,000 for the year. So really looking at where we're at, we are doing a lot with our billing department. We were without a biller for several months and really getting caught up. But the other piece of this is also looking at what we're charging for fees for service. And so we've got a couple of proposals, and those are not included in our forecast here. So our projected revenue for '24 is $498,150. And again, that doesn't include any new fees, but we are working with childcare licensing and environmental health. Those fees are set in resolution, and so the work has begun to look through those. But also, both Missy and Carrie have fee for services in most of the work that they do. Certainly Carrie. And what's become known to me is that most LHDs here in Kansas are looking at fees either yearly or certainly every other year, and that has not been a practice at our health department. And so that's something that we intend to implement, knowing that we need to keep up with changing times, if you will, and what our services are costing. And this is the last slide, but just briefly about our aid to locals. I mentioned, again, we've seen just a steady increase in our funding through the years in some of the grants. Some of them have remained very much. But aside from our general fund request, this is really the rest of our costs, our money that we use to operate the health department. So this is a variety of grants here. We don't get every aid to local grant. Some we're not eligible to apply for. We're not doing the work, but we apply for the bulk of them. And as I mentioned, we continue to seek other grant opportunities, knowing that that's important to help offset our general fund request. That concludes the slides, and I'm happy to answer questions.
Just gonna ask the hardest question. So let's say that your funding request is only approved for $1 million instead of $1.4 million. The $400,000 decrease from what you've requested. What happens to the health department? What would be the impact of that?
Yeah, that's a great question. As I mentioned, we've looked at some of the positions that we feel like we could get by without filling. Those are tough conversations to have. For me and for probably all of us sitting in this room, if it's an unfilled position, that's easier than a filled position. But yes, there will likely be some hard conversations, whether programs continue. Do they reduce their capacity? Are there programs that need to go away completely? As it stands, without the request, we will not be able to keep the amount of staff that we currently have. And I think we would look, Commissioner, to the programs. It's hard to quantify, though, when I say most important to the community, because every one of these individuals sitting in this room is going to fight for their positions and their programs. And so very tough discussions to be had.
Okay, thank you.
Commissioner Mays, do you have any questions?
Well, so I didn't add it up. What's the total of your unfilled positions? How many of those? Because, I mean, I see you've got 6 RNs here.
We currently have 13 when we wrote the budget. We're up to 14.
And how many of them did you say are not advertised?
Ooh, how many are not advertised? That's a great question. Let me look here. 1, 2, 3, 4, 5. I've got 5 so far on my list that are not advertised. Team, maybe you can help me out. So I've got Missy, you only have 1 position that's not advertised. Craig, you have 1 position. Carrie, you have
3 that aren't advertised, but 1 that will be.
Okay. Okay, so we've got 5. But those 3, 1 will be advertised soon?
Right, we're reviewing it.
Okay. So she currently has 3, but one of those needs to be opened.
And then there's 1 in the admin section, the accountant one.
Correct, yes, sorry, thank you.
So, you mentioned a lot of this is because COVID was funding some things that, or not COVID, but ARPA funds were funding some things that are not gonna be covered by that anymore. Is there a way that we could get a list of those things, or is that in here and I'm just missing it?
No, it is not in here. We would, I'm trying to think. It's covered a variety of things. So it's covered a variety of staff positions, like including myself, and different contracts. Yes, I think as I look, we can definitely get a variety, pull that list together of what it has covered over the years. The other item that I did not mention is that this is our first year in the general fund. And so prior to this year, in looking back from 2016 on, we did have our reserves. And reserves were used each and every year also to essentially fund the program and make it whole.
Mm-hmm.
But yes, we can get you that list
Okay.
of items.
Do the reserve numbers if you would like them.
Okay, that'd be great. I guess the reason I ask is because, you know, we had the Spark Committee and we tried really hard to only use ARPA funds for kind of one-time temporary expenses. And I know it's not always been that way. I know that the corrections has some issues with that as well, where we funded some wages and whatnot.
Let me clarify, Commissioner Mays. The COVID dollars that we have used for these are separate from the Spark dollars.
Okay.
So these were separate COVID grants that the health department received. It's completely separate from the Spark
Okay, so
dollars.
these are like directly from the federal government or from the state or whatever?
Yes.
So, okay.
Yes.
And we also had one, that was a HUD grant through the city.
Yes.
There were state grants.
Yes.
Okay.
Yeah, so completely, thank you for clarifying, separate. We did have 3 projects, 2 of which move forward that are Spark, and they are just one-time only dollars.
Yes,
So,
those were very much one time.
yes.
Okay.
So none of the Spark dollars were used in this. I apologize for not clarifying that.
Okay, good.
Under professional services, you mentioned licensing.
Yes.
So before the union paid for some of this, and now they're not? Or?
No. Prior to this union agreement, it was all on the individual staff members. So every nurse paid for their own nursing license. Social workers paid for their own nursing license. Same with dietitians. And so the union agreement that became effective just earlier this year has that written in that they will be reimbursed for their license fees. And those are, I think all of them are every 2 years, and the price varies.
Can you give us a ballpark?
Yeah, for a nursing license, I believe it's around $80. Social work, anybody? Or about the same. And dietitian? Okay, so it sounds like dietitians are a little bit more at $135. And so that happens to be one particular grant, the WIC grant, that licenses are not an allowable on.
Okay. All right.
It looks like the majority of that category, though, would be Dr. Locke's fees
Correct.
that is showing the increase.
Yes.
Yes.
I know earlier you mentioned that a fair amount of your time is spent watching for grants and grant opportunities. I think Betty and I are both aware of, there's a software product that we might look into that you can put what you're looking for into the software project, and it notifies you when opportunities come up, as opposed to you going out and having to fish. It delivers them to you.
Okay, excellent.
And you can, there's a lot of different options, and you can pick as many of those as you want and narrow it down as much as you
Okay, that sounds like a good opportunity.
On here, your Easy EMR software.
Yes.
You have that almost doubling. Is that just the maintenance is increasing?
No, that again was because that had also been covered by a grant. And so I am actually in the process, that is our electronic medical record software. And I'm in the process of negotiating a new contract, and I was able to verify in writing that our cost will not be increasing. That contract expires later this year, that those costs will stay the same.
So, I'm gonna go back to something unrelated to this, but related to the health department. We had authorized funding to buy a big bus type thing at one point. Whatever happened with that? I know you were hoping to get some matching grant funds from somewhere else. Did that ever happen?
No, Commissioner Reese, that was one of our 3 items for the Spark Committee, and so that had initially made it through the Spark Committee. I worked with Emergency Management, specifically Nelson Castile, to apply for the FEMA dollars that would potentially cover that. And it was denied through FEMA, and so when it came back to the Spark Committee, that project was actually struck from the list.
Okay.
Commissioner Mays, just doing quick math, the 13 unfilled positions add up to $595,949.
Okay.
If all 13 were unfilled.
Okay. I appreciate that.
That is the number I had also, but I think only 400,000 of that is general fund. The rest of it's grant.
Jennifer, what was that number you said?
400 of the 6.
Yeah, I had 419,000 from what you had said earlier.
I went through their worksheet, 595, 40, not 595,949.
Yeah, so then you would add benefits onto that on top.
And then subtract out what would be paid by grants.
Yep.
Yeah.
So, how's your overtime looking these days with these vacancies? Are people working a lot of overtime?
You know, we try really hard to not have overtime. I mean, even with vacancies and knowing that we have, grants or general fund to cover it. For lack of a better term, the pandemic, for those of us that are still at the health department, left a lot of people very scarred. A lot of people remember working 60, 80-hour work weeks. And so I take pride in trying to keep that work-life balance. It is a piece that every staff member is looking for and very important as new staff on board also. We do have some occasional overtime. Our billing department comes to mind as a program that has frequent overtime. Either late in the evening, working weekends. I think clinical services, at times has different overtime, but largely we're not seeing a ton of it, which I think again is a testament to staff stepping in and taking up, but also all of us recognizing that if we burn staff out, it's not going to help us in the long run either. There's a lot of job opportunities, and I don't want to lose the valuable staff we have.
With the shortage of nursing and everything, do we anticipate any retirements that might even add to your misery out there?
Yes, Commissioner, I do. There's a possibility that we would have an additional nursing retirement later. From our retirement list, we've got lots of eligible employees. I have 2 impending retirements that are coming sooner rather than later for me, and looking to figure out how we'll fill those. Those positions I'm referencing right now are not nurses, but yes, I mean, it's a real challenge. I don't remember a time at the health department, and I joke with my staff, I've been here forever, but I don't remember this many vacancies for this long a time.
What is the outlook for getting nurses grants?
To be honest, I think Carrie and I could use the word bleak. Carrie's had no applicants for her positions at 10th Street. Even with our sign-on bonus, Missy and Carrie and I are all nurses by trade, and we receive mailers almost daily recruiting us. Hiring bonuses, I think the highest we've received is 30,000 from somewhere. So it's definitely a challenge. Carrie and I have entered into conversations with the staff to see if there's some contracts that they have an opportunity to explore to be able to help us with at least with some long-term temporary staff. With our electronic medical record, it doesn't make sense for us to be bringing people in all the time, and just the work that they're doing is complex. And so we were looking for that. We have a contract with Cascade, and we're exploring that ourselves, but to be honest, they have not turned up anybody that is interested in doing some long-term temp work for us.
All right. Any other questions?
Nothing I can think of right now.
All right.
Okay.
Well,
Thank you,
Teresa.
Commissioners.
Thank you.
Thanks, sir.
Anyway, well, this is my one opportunity to, stand up here and talk to y'all. And I get a chance to kind of give you a little rundown of what the county clerk's office is all about. And we're stuck in the statute at 19301 et sec. And if you take the time to go through the statute books, pretty sure that every statute book has something about the county clerk. Either we're supposed to take applications, or we're supposed to file something, or we're supposed to do something, because that's just the nature of the office. Matter of fact, recently you just adopted a resolution based on the homestead, where the properties are destroyed by natural disaster. And sure enough, the county clerk has to take the application, work with the treasurer and the appraiser to, present whether or not we feel that the qualifications have been met for the statutory tax credit or abatement. With these duties, of course, I'm your secretary, you know that, and I keep your county seal for you, nice and safe over at the office. We set the tax levies for all of the 49 tax entities in the county. I prepare the tax roll for the county treasurer so that they can collect the taxes for you. And I'm the Freedom of Information Officer. We're also charged with updating the real estate records. And this is kind of I think people know this, but to understand the importance of it, this is how the tax statements get to the right place. This is how, well, of course, our R&R notices get to the right place as well. But it's very important, that's a very important part. Not only just people deeding property over from one to the other, but there's divorces and there's probates, because we get, anytime there's a real estate transaction through the courts, we get a copy of that order as well. In my office, we are the accounts payable, so since we have centralized accounts payable, my office pays all the bills for the county. And it's really, and I swear in all the officials, boards, and elected and officers to a certain extent. the cities swear in their own, their clerks swear in their own elected officials, and the school boards swear in their own. But other than that, at the county level and the township level, I swear all of those people in. I am also deeply involved. We don't have a separate economic development department in the county, so all of the EDX applications come to my office. And then of course, that upon payment of the application fee to me, that's one of my revenue sources that I have here, I get for the county. We receive the application and we send it over to the county councilor's office for review. And then I am also a voting member by resolution of the Economic Development Committee. And then we review after the county councilor's through, that we review the application and present it to the commission for consideration for economic development. Now, in a little less than a month, we get to go do our new favorite thing. The revenue neutral rate notices will be going out. Last year, the response to the notice was an interesting mix. People in Shawnee County are just, overall, we are like 99.9% nice people. You know, you have that one or two, because they don't, at least us. But when they get it, they ask what it was. They didn't complain about it. Most of them thought it was their notice from the appraiser. And when we told them it wasn't, many of them argued with us, the fact that it really wasn't that. But some of them we didn't get as many calls as we thought we would. I mean, we ran up, we had these little Q&A things that we gave to the appraiser's office and the treasurer's office and my staff, just in case. And we were prepared for this, inundated, and they must have either looked at them and said, something else in the county, I'm going to put it with my tax information, or they understood it, which hopefully that's what it did. The cost for printing and mailing last year, I think last year I gave you an estimate of around $50,000. It ended up being $44,155.65. Now, they give us a discounted bulk rate of 45 cents per item. And of course, today is the day that the postage rates go up. So I don't know if we're going to have that same rate, well, based on the postage rate going up, plus I'm sure their cost of printing the notices. So I'm expecting to have that cost be higher. But this will be the last year that we will, because we did get reimbursed from the state last year. This is the last year they will do that. KAC and the Kansas County Clerks and Election Officials is trying hard, lobbying the legislature to try to get them to continue to cover the cost. But if they don't, then next year at this time, after we send the notices out and before December 31st, we will have to break down the cost, and I think we're going to do it by their valuation. Anybody who actually sends out a notice will have to pay their share of the cost. Now, last year we had, of the 50 taxing entities, we have 41 of them actually had a revenue neutral rate hearing as part of their budget hearing. And there are some counties across the state that they haven't taken any official action, but their county clerks are kind of telling them that, or telling the rest of the county clerks across the state that they have just decided they are going to continue to pay for that just the same as they do for the mailing of like tax statements and value notices. That's for you to decide. My office has 3 divisions. I'll give you a quick rundown of those. My accounts payable division we're doing a very, very good job of adhering to making all new vendors, they have to have ACH deposit. This is so important because I had Rhonda look up the numbers. On 6/20 of 2018, we printed 699 checks to be mailed out. On 6/20 of 23, we had 85. That not only, I mean, Betty is a great advocate for this. The cost was, how much is it, Betty? $6 or $9? It's some per check. The cost is unbelievable, and now that's just the paperwork. That's not even my staff's time. It's around $10 or something per check if you write a paper check. And so we're saving, we're saving money on our side, and we're saving my staff's time. Matter of fact, when we're, the hiring and losing people at the office, there have been many times that I've actually had, gone back from the meeting, and I take the time to process checks. And this has been over the couple of years. It would take me, I would say, probably 6 to 7 hours just to process the checks, to get them where they were supposed to be. And then, of course, you run the risk that they went to the wrong place, or there was something, and then you have to go back, and then you have to, the whole check cancellation. There's a lot of savings going on right now. And my administrative division, we are, of course, they are over here with me for working with you with the meetings. They also take care of the cereal malt beverage licenses and the occupational tax. They take care of typing up our minutes. And of course, the big one, as the Freedom of Information Officer, is the open records. And we don't receive all of them, because some of them go directly to elections or the sheriff or the courts, or, well, if they go to the courts, or the DA. But we still, in 22, we had 119 core requests, and so far this year we'd have had 43. Now, when you say a core request, we get them, it's not just, most of them are not just, I would like a copy of a contract. We get an open records request for, recently it was a list of employees that work for the Department of Corrections. Their number of years they've worked for the Department of Corrections and whatever. Of course, that has to go through HR, but one core request is not necessarily just one piece of paper, and it's not just we process it. So they're saying there's only 43 this year. Doesn't sound like a lot, but that still is a lot of time for my staff and the other, whatever department had to supply the information. In my tax and real estate and economic development division, we work real close with the appraiser's office and the treasurer. The ownership transaction, of course, is important to all three of us in many ways. My office, well, right now we're in the construction phase, but my office, real estate, is the reception portion of the office. They're the ones that when you call, they are the ones that answer the phone, and they're the first ones you see when you walk in the door. They also are the central ones for when the homestead tax exemption and for the 65 and older, they work with them, and I actually have these people that will, when I come through the office, they will say, we really like working with, and then they'll say, they know them, like Andrea or Lucy or Tricia. They know their names because they've dealt with them so many years, which is very heartening for me, because it's scary come to the courthouse and not knowing what you're doing, but the homestead is an important part of these people being able to stay in their homes and afford the taxes. Also, my chief deputy is the supervisor for the tax to the tax division, and she is really important to me. She assists when we work with the taxing entities to work with their budgets, which is what we're doing right now. And we also have, the state has several abstracts that they require. One has to be done in July and another in November, of all of the values and the personal real 1620M and watercraft, such like that. And so she takes care of that and sends the reports off to PVD, which is a requirement. That is it. Okay, so far my budget for this year, a little bit up from last year because of the payroll. It's $1,021,555, and it is $1,004,180 is the wages and benefits. $97 is for contractual services. $72 for, or $700,200 are for supplies, and we have $475 is for the licenses. When you have a CMB, we have to pay the state $25 for their license fee, for their seal, for the ability to have the seal. But that $475 is paid back to us in, if you look at the revenue portion of my budget, I have that listed on there. So for the expense that we have on there for the licenses and sales tax is a wash for all intents and purposes. But I wish it was more, but I want to thank you from me and from my staff for what you have done for on the wage study again this last year. It was very, very appreciative. We have great benefits. Everybody in the office is very pleased with that, especially with all of this right now. I'm shifting people around because of the dust and the whatever, but it'll be done good after a while. And with the fact that we have competitive wages, and I'm able to keep good staff, and I do have good staff. My staff offers excellent customer service, and I'm very proud of them. We make sure that all of our interactions with the public reflect on not only my office, but Shawnee County as a whole, and we will continue to offer that same service to them. So, any questions?
For me.
Yeah. Thank you, Ms. Beth.
Thank you. Thank you very much.
No problem. Somebody left a pen up here.